Hello, everyone. Welcome to another episode of Doctor Story. I am Anchal Arora, a digital consultant at MyCare. Today, we will discuss about lumbago. You might be wondering what it is. It's the pain in the lower back. And to simplify it further for us, we have invited a national board certified spine surgeon with an experience of over 3,000 spine surgeries over last 15 years. Ladies and gentlemen, please welcome Dr. PHANI Kiran here to help us resolve this most commonly suffered pain. A warm welcome, Dr. Kiran, and welcome to Doctor Story.
Hello. Hi, Anshul. Thank you. Lumbago is another term for the common low back pain, and it's a very common problem. So it's a very interesting topic for a lot of people.
Right. Starting with this lower back pain, what induces such pain? What are the major causes of lower back pain?
So the most common, I would say, it's more than 80%, 80 to 90% of the lower back pain is due to an overstrain or minor injury or a postural strain. It's a recurrent strain that happens to the lower back structures in the lower back, the muscles, the joints, the ligaments. So these get injured or overstrained, most commonly due to bad posture. So postural strain is, if you say simply, the postural strain is the most common cause for lower back pain. There are other causes. There are some age-related changes that happen in the spine as one gets older. They do contribute to the pain, but these age-related changes are not always painful. In some of them, they do contribute to the pain.
Okay. Is lack of movement also a cause of lower back pain?
Yes. Prolonged sitting itself is a risk factor for back pain. When a person is sitting, there is highest amount of pressure in the disc. The spine is just for the introduction to understand what spine is. Spine is a structure in the center of our body, which is the axis to which everything is attached. The ribs are attached to the spine. Our head is attached to the spine. The pelvis is attached to the spine. So, and all the organs, the muscles, the abdominal muscles. So, all these, it's a chain of bones, basically. Like, let's see here. It's a chain of bones, and in between the bones, there is a disc at each level. There is a bone, there is a disc, there is a bone. So, it's a chain, and this chain has to stand erect, and that needs support of soft tissue structures, the muscles mainly, the joints, joint capsules, ligaments. So a lot of soft tissue structures support the spine. The spine also houses the spinal cord inside the spine. So there is a canal, and inside there is a spinal cord, which is the main nerve which connects our brain to the rest of the body. It's like the main cable connecting the CPU to the other parts of the computer. So this spinal cord carries all the signals from our entire body to the brain and back from the brain to the body. So this function of the spine is to protect these neural structures inside. At the same time, to allow movement in various degrees. You can see how much our neck moves, how much our back moves. So it protects these nerve structures, at the same time allows movement in various angles and degrees, right? And at the same time, it also allows us to function in our daily activities without injuring the other organs.
So, with the lack of movement, like today, most of us have these desk jobs, and especially post-COVID, most of us have shifted to the work from home culture. And as you said, the prolonged sitting So is there something we could do to avoid this pain?
Yes. So human body is designed to move as you see the evolution. Our evolution happened when we were supposed to move, run. It's not designed to sit in one place,
Right.
evolution wise. But what our lifestyle nowadays is mostly restricted to sitting, especially those who have computer professionals or software jobs, even other accountants or a lot of professions. They have because of the computers, they have become restricted to a desk and a computer and a chair. So it's kind of an epidemic that this sitting, prolonged sitting, is causing a lot of back problems, neck problems. So one needs to maintain two things. One is important thing is to maintain the right posture when you're sitting. So one has to make sure that the posture is not wrong. A lot of people while working they are so involved that they don't realize they are in a very bad posture. There's a forward stool, they're looking down, or there's a slouch, or they're sliding and sitting. So all these sitting in bad posture makes it worse. Sitting itself is a strain on the lower back and even in the neck, upper back. But sitting in bad posture even makes it worse. So first thing is maintain the right posture. Make sure your spine alignment is good. There is a proper lower back support, and your neck is not stooping forwards or looking down a lot. That is one. Second thing is to take frequent breaks every 1 hour, ideally even less, 40 minutes, 45 minutes. One should get up and take a break for a few minutes, walk around, stretch, and then sit again. Sitting for 2 hours, 3 hours, prolonged sitting is one something one should avoid. And third and most important thing is exercise. So one needs to maintain the flexibility of the spine and also keep their muscles strong. So as I said, spine is a chain of bones. It needs a lot of muscle support. If your muscles are weak, there is more strain on the spine. So strong muscles, strong core strength is going to reduce the strain on the spine and prevent these recurrent episodes of back pain.
Okay. So that way we said it's about exercising, stretching, maintaining the core. If somebody is actually experiencing the pain, and what can be the immediate solution to alleviate the pain? Like immediate, what has to be done next? What is the next step? If I am experiencing the pain right now, what should I do now?
Yeah. So this acute episode of back pain, like a sudden catch in the back causing severe pain, it is fairly common. It's pretty common, and it's something that really creates a lot of fear in the minds. There is pain, and then there is fear. It's a combination because there's some people get really panicked about something really bad happened. But most of the times, it is, as I said, it's just a minor injury. It can really cause severe pain and spasm. So when there is severe pain, the muscles go into spasm, and the spasm increases the pain. Pain increases the spasm. It becomes a vicious cycle, and it ends up in this situation of severe pain, and even little bit of movement is very painful. They don't even move from their whatever position they are. So that first thing is there is no need to panic. First, just calm down, and one needs to just lie down and just take rest. First of all, just take bed rest and apply some ice packs locally wherever there is pain. Apply some ice packs and apply. You can apply some pain gel if you have, and take a common painkiller like a paracetamol or aceclopinac if you have one, and then just reach a nearby medical professional or a small clinic or a hospital where they can give you a basic analgesic for the time being. But there is no need to worry. Usually, if you are at home and there is an episode of this kind of thing, most of the times, it settles down with 2 or 3 days of rest and some icing and some basic medication for pain.
Right. So, uh, with that, as you said, the icing part of it, does fermentation also help? Like some people use those heating electrical pads or hot water bottles. So is icing better or fermentation is better for the lower back pain?
In general, for an acute pain, uh, it is better to use icing.
Okay.
Icing, but it's not that one should not use heat or hot fermentation. It can be used. The best thing is to alternate icing with heat. If it's acute injury kind of situation, try to avoid heat. But if it's a chronic pain, it's been there for long, so there's some aggravation, then do some icing first and then apply heat. Because heat alone, if you use it, heat tends to increase the blood supply. And sometimes there's an inflamed area, it can increase the inflammation there and sometimes can make it worse. But then there is a small this thing in this. It depends on the climate of the area also. If it's a very cold place, then maybe little bit of hot fermentation is more comfortable than heat. Then cold ice packs.
So at the time, as we said, the person is experiencing the pain. Should the person at that moment avoid stretching or, certain yoga poses, like certain people start doing the cobra pose or stretching the back? Should we avoid at that very moment? As you said, it should be a regular thing. You are getting into a routine, the
Yes.
exercise. At the
Yes.
moment of it, he should avoid. That's what you meant, right?
Absolutely. It's very, very important because a lot of people they tell me, patients tell me that when I exercise when I have pain, or when they have this pain, they tend to do these stretches. But that is something one should avoid. When there is pain, especially if it's a severe pain, one should not attempt to do any stretching or exercises. They should just take rest. After the pain subsides, then they should take the guidance of the physio and learn some proper exercises and keep doing those exercises so that these recurrent episodes do not happen.
All right. Thank you. Thank you for clearing that doubt. We received like so many comments and doubts about that yoga poses. All right. About the link between age and the pain. So, is there like older people are more vulnerable to the lower back pain than compared to the young?
Yes, as one ages, the spine undergoes age-related changes, wear and tear changes, like you have arthritis in the knee joints or hip joints, or these age-related changes. There's some changes externally you see. So same way the spine internally also undergoes wear and tear. It starts in the discs, and then it also affects the neighboring bones and joints. So, but most of these age-related changes are natural, and they do not cause pain. Right? Aging is natural.
Right.
So many times, what happens is they do an X-ray and it's reported as spondylosis. So many people think it's kind of a disease, and they get scared. Even on the MRI, there's a reported this thing saying there is degeneration, there is spondylosis. All these things one should understand are natural age-related changes, and it is not necessary that all these changes are painful. In fact, most of them are not painful. But some of these wear and tear changes do cause pain. So as one ages beyond 40s, 50s, 60s, everybody has age-related changes, and these worn out joints and discs can cause back pain. So as one ages, it is more one of the more common reasons for pain. The other reason in old age for pain is the osteoporosis, which is weakening the bones. The bones become more porous and they start crumbling, especially in women after menopause. So that is something that can cause pain in older age. So in general, older people are more at risk of developing back pain due to degenerative changes as well as osteoporosis and other reasons also.
All right. As you mentioned MRI, I wanted to ask what is the role of MRI when it comes to lower back pain?
So that's MRI is something that not every patient needs to undergo. Most of the patients that we see, we make a clinical diagnosis, and there are certain red flags that we look for. If there are any red flags, signs of some serious disease, red flags like pain with fever, pain with weight loss, previous history of steroid use or some other chronic disease, old age, pain that has been there for more than a month, not responding. So there are certain red flags that we look for when we take the history and examine the patient. If there are no red flags, and this is first or second visit we are seeing the patient, there is no need to jump into doing an MRI. Right? There are specific reasons why one needs an MRI. When there are one of these red flag signs which indicate some serious disease, when there is one of these red flag signs present, or if whatever treatment we have given, the basic treatment, medicines, physio, rest, all these things have not helped, the pain is persisting and keeps coming back, that's when we do some sort of imaging. Initial screening is X-ray, but best thing is to do an MRI to get the spine in detail. But MRI is like again, it's a very sensitive investigation, and it's, as I said, it's kind of a double-edged sword. So many people, once you do an MRI, they, especially the youngsters, they go and read the report and they Google and see. And I've seen many of them, they get so scared after reading the report that they really come sweating and in a big panic because they, whatever the radiologist, obviously they report whatever is seen, but most of them are in the process of natural aging that we see, and many times the pain that they feel is not always related to what we see on the MRI.
Taking sleep into consideration, as you talked about the right position, I want to just ask about that. Is there any right position to sleep? Like, does the pillows or type of mattress make a difference? And if yes, so what do you suggest would be best?
Yeah, this is a common question that a lot of patients ask. What I always tell them is sleeping position is not so much of an important thing compared to sitting position or the position they work in. So that's when the actual strain happens. And coming to sleeping, in general, there is no particular position that is really recommended, or whatever position one is comfortable. In general, if there is significant neck pain or there is some patients with back pain, it's better to avoid being in prone position, so face down. Try to avoid that. Lying on the sides or lying straight with a pillow under the knees bent. That really helps when there is, especially when there is acute pain. Keeping the legs bent does relax the lower back structures and reduces the pain. And using a mattress, yeah, it's again very commonly asked question. Only thing is there is no need to think too much about it. The main basic thing is the mattress should not be very soft. Should not dip down when you sit on it. Anything which is comfortable and firm is okay. Whatever material it is made of. The basic thing is it should not dip down when you sit on it. Should be
So it
firm
should
and
not take
supportive
the
to
shape of
your
your
spine.
body when you lie on the mattress.
Yeah, it should not sag down when you lie on.
Okay.
There are these memory foams and all that, so that they little bit adapt to the shape of yours. That is fine, but the bed should not be as a whole, should not be very soft, sink in.
Okay.
And for the neck, while sleeping, one should try not to use thick pillows. A thin pillow or a medium pillow, which is comfortable. That is what one should use. Avoid thick pillows or double pillows. That is going to strain there.
Okay. And also, one of our subscriber also asked about the treatment for back pain for women after childbirth. So, what can be the do's and don'ts for them?
So it is very common that women after childbirth, the initial 1 year, 2 years, many of them come with back pain, and the main reason is during pregnancy the muscles are stretched, the abdominal muscles are stretched and weakened, the pelvic floor muscles are stretched. So and some of them have a cesarean section also, and after delivery uh, there is a lack of enough emphasis on regaining that core strength, or they don't have time taking care of the baby and household chores. This is very common that they don't put enough efforts on exercising on themselves. So that what happens is their core strength remains weak, and there is an overstrain into all the routine work they do, taking care of the baby. So this is very very common. This is the most common reason for the back pain in the post delivery women. So the emphasis on initially before delivery itself, during in initial stages of pregnancy or even before that, if there is emphasis on exercising, keeping your core strength up, and at the time of delivery, after delivery, there needs to be education about improving their regaining their core strength. That is very very important. If they do that, many of them can avoid having these episodes of back pain.
You have like 15 years of experience and you have performed more than 3,000 spine surgeries. What are the most common misconceptions people have when it comes to spinal cord?
Misconceptions about spine, yes, there is lots of misconceptions. Um, uh, there is misconceptions about the cause for back pain, and then there is misconceptions about treatments. So the cause, many people think that the back pain is somehow related to stomach, the gas trouble causing back pain, which is pretty rare. Stomach ulcers, or they do cause upper back pain in some, but it is not the common reason. The other reason people associate with is a kidney stone or a renal kidney related pain. Again, there is a different characteristic of pain that is coming from the kidney. So obviously we have to differentiate that when we examine. But many people think that the common back pain that they have is somehow it is limited to the kidneys. So that is the other about the reasons. And regarding again about pregnant ladies, you said. So when they have a cesarean or a epidural, spinal anesthesia, the needle that is used to give spinal anesthesia. So almost all of them blame the needle for the back pain that they develop later on in their lifetime. So that is again a misconception that needle has nothing to do with the back pain that you develop later on. It's this epidural or spinal anesthesia does not lead to back pain later on. About the treatments, many people, one is, as you said, they start exercising when there is pain. That is wrong. The other is lying on a hard surface or lying on the floor. It is not really necessary to do that. Maybe it was an advice that was given when people had those sagging cots at home in older days, but that's probably not necessary now. You can use a comfortable bed and firm bed and lie on it. And there is about surgical treatments and who needs surgery, but there's a lot of fear, and again there's a lot of misconception about surgical treatments for spine. That in general, spine surgery nowadays is very very safe, and we always select the patients who really really need surgery. And here I would like to say that more than 90% of the patients we see do not need surgery. We do not advise surgery for more than 90%. So there's a very selected few group of patients who really need surgery. And in those patients, if you are in need of a spine surgery nowadays, it's very, very safe. There's a lot of advancements in the technology and the things that we use and the training, and there is no need to worry.
Great. Well, thank you so much, Doctor, for taking out time for us and clarifying all our doubts and queries. Thank you.
Welcome. Thank you.
For all those watching us, I hope you noted down the points our doctor shared. If not, make sure you save this video for the time you actually experience the pain. For now, thank you so much everyone for watching. God bless, and we will see you in another insightful session of Doctor Story.